Eating, drinking, swallowing, and even speaking and laughing are all functions closely related to the teeth. During smiling and laughing, it's mostly the front teeth which determine the facial expressions. The front teeth also bite off food. Chewing, that is crushing the food, primarily involves both the upper and lower back teeth. This skull shows clearly that the upper teeth are retained securely in the skull and the teeth in the lower jaw can be moved in several directions via the temporomandibular joint. The temporomandibular joint consists of the condylar head and the mandibular fossa. During simple opening and closing movements, such as yawning, the head rotates in the fossa. The mandibular fossa is a cartilage-like disc which can also slide along the sloping plane of the skull, that is, the condylar path, thus enabling the person to chew and swallow. During chewing and swallowing, the movements of this universal joint are also influenced by the occlusal surfaces of the teeth. If a dental technician is to fabricate a correctly functioning denture for a certain patient, he must be able to simulate the complicated movements of the temporomandibular joint in the laboratory. To do so, he makes use of this complex, expensive, and extremely precise piece of equipment called an articulator. Principally speaking, articulators correspond approximately to the anatomy of the head and can be used to imitate the movements of the lower jaw in relation to the upper jaw. These units can be adjusted as required to suit the specific patient. This assumes, however, that the dental technician knows how the patient's lower jaw is normally positioned in relation to the upper jaw. But what is the normal position? During swallowing, the cusps of the back teeth always guide the lower jaw into the normal position. This situation is taken advantage of in prosthetic dentistry to determine the normal position. Taking the bite with bite blocks. Bite registration with 2 wax blocks is a simple and economical method for determining the normal position of the lower jaw in relation to the upper jaw. The blocks are made by a dental technician according to the impression. The correct position is then determined in the mouth by means of a so-called swallowing registration, as can be seen here.
Kontakt war zwischen den Bissschablonen und diesen Kontakt halten Sie. Sie öffnen den Mund nicht mehr. Ich werde alles weiter selber machen.
The patient takes a sip of water, and as the patient swallows, the bite blocks for a short moment come into contact with each other. This contact position should be maintained, and with 3 marks, the position of the wax blocks is registered. The 2 wax blocks are melted together outside of the mouth to enable the dental technician to mount the plaster models of both jaws in approximately the correct position on the articulator. Taking the bite and recording the vertical dimension by means of intraoral registration. Dentures certainly function better if the bite has been registered accurately. So-called intraoral instruments are used for this purpose. These consist of a metal disc for coloring and a marker fitted to a plate in the lower jaw. If the patient moves her lower jaw forwards and sideways, an arrow is marked on the plate.
Und wieder zu mir, einmal den Unterkiefer. Danke. Und wieder auf. Und wieder zu. Und da drüben hin. Prima. Und wieder zu. So, vielleicht nochmal aufmachen.
Gleich raus mit dem Anfang.
Zulassen. So, da fangen wir an.
Both registration instruments are then secured in this position. As when using wax blocks, this can be used to accurately transfer the correct position of the two jaws in relation to one another onto the articulator. Taking the bite extra-orally. The distance between the patient's temporomandibular joint and rows of teeth, as well as their angulation, are also very important because the denture teeth should be arranged in exactly the same manner. Dentists speak of taking the bite extra-orally. Extra-oral means outside of the mouth. This type of equipment is used for this procedure. This procedure is based on an imaginary line running from beneath the eye to the external auditory canal. The transfer bow, which is what this registration unit is called, permits the position of the jaws to be determined very accurately in relation to each other and the temporomandibular joint. The angle between the rows of teeth and the ear-eye plane mentioned previously is established at the same time. The results of this registration are transferred precisely to the articulator by plastering the models onto it. One can see clearly that this precise registration procedure transfers the prevailing skull conditions exactly to the articulator. This is important if dentures are to function properly.